We undertook a review of ophthalmology services across Wales, concentrating on wet AMD, in order to understand how effectively our health boards using all their resources that are available to them to provide safe and effective care to all their patients. Our review has highlighted capacity issues in relation to ophthalmology services in Wales and indicates that demand has outgrown this capacity. Significantly, we feel that more work needs to be done by health boards to understand the needs of their populations in order to design services to meet those populations. In particular, more work needs to be done to make sure that individuals receive care in a timely way, in a way that's effective, and to ensure that the care and treatment that's provided is safe and lessens harm. Following this review, there's a need for each health board and Welsh Government to supply an action plan demonstrating how they're going to address the issues that we found during our review. The ultimate aim is to ensure that people and patients receive timely, safe and effective care across Wales.